Hello everyone, welcome to the AY tutorials. Today we are going to see general anesthetics. Introduction. General anesthesia, reversible loss of consciousness accompanied by analgesia, amnesia and muscle relaxation. In general anesthesia, there is temporary loss of consciousness which is induced by the drugs called general anesthetics. Do you know how general anesthetics works? Generally, anesthetics are injected into the vein or inhaled as a gases. Anesthetics also include analgesics and some neuromuscular blocking agents and a muscle relaxants, and also a breathing tube which may be used to help the patient breathe during surgery. There are some general side effects of such a drugs which include lung damage, allergic reaction, breathing problems, injury at the injection site, heart attack, dizziness, temporary confusion and memory loss. So while giving such a medication, there are certain things that must be taken into consideration, like patients are often fasted before general anesthesia to prevent the pulmonary aspiration, and while giving the anesthesia, certain machines are required compulsorily, like ventilators, gas supplies, vaporizers and monitors to display the vital signs. The form of anesthesia is chosen based on the type of surgery you are having and your overall health, and also your preferences by your anesthesiologist. There are certain conditions that can increase the risk of complications during the surgery, and which includes smoking, sleep apnea, obesity, high blood pressure, diabetes, stroke and seizures. Medicines that can increase the bleeding and previous ADRs, that is adverse drug reactions, are also taken into consideration. Goals of general anesthesia: analgesia to relieve the pain, then unconsciousness, that is loss of awareness, then amnesia, that is loss of memory, muscle relaxation and homeostasis maintenance. Maintaining the homeostasis during the general anesthesia is very crucial because the anesthetic drugs can significantly disrupt the body's normal physiological balance, which potentially leading to the serious complications like organ damage, impaired tissue healing and increase the risk of mortality if not carefully managed. So therefore, anesthesiologists always monitor the vital signs. Stages of anesthesia. Stage 1, analgesia. Patient is here sedated but able to walk. Breathing is slow but regular, and the patient loses the ability to feel pain. Then second stage is excitement or delirium. At this stage, patient may experience uncontrolled movements, fast heartbeat and irregular breathing. At this stage, patient may vomit, which could make them choke or stop breathing. Then third stage is surgical anesthesia. At this stage, the patient's eyes stop moving and their muscles completely relax, and they may stop breathing without the help of machines. Then fourth one is medullary depression. At this stage, patient's brain stops telling their heart and lungs to work. This is very rare with the modern technology, but it can be fatal. The depth of anesthesia is estimated by accessing some reflexes. Some reflexes include eyelash reflex, eyelid reflex, corneal reflex, glottic reflex and carneal reflex. Mechanisms of action: central nervous system depression by GABAergic enhancement. General anesthetics enhance the inhibiting channels like gamma aminobutyric acid, that is GABA receptor. Then NMDA receptor antagonism. General anesthetics blocks the excitatory channels like N-methyl D-aspartate, that is NMDA receptor. Then other ion channel effects. General anesthetics affects two poor potassium channels which reduce the neuronal excitability, and its other targets are voltage gated sodium channels. Classification of general anesthetics. General anesthetics classified mainly into two types: inhalational and intravenous. In inhalational, gases, nitrous oxide, and volatile liquids, ether, halothane, isoflurane, desflurane and sevoflurane. In intravenous, fast acting and slow acting, in fast acting thiopentone sodium, methoxytone sodium, propofol and etomidate. In slow acting drugs, in that benzodiazepines, diazepam, lorazepam and midazolam. Dissociative anesthetics, ketamine, and opioid analgesics, fentanyl, ramifentanil. Factors affecting anesthetic action, in that first one is age. Generally, older patients may require lower doses of anesthetics due to altered metabolism. Then second one is weight management. Dosage adjustment is needed based on the body weight. Presence of other disease. Existing conditions like heart disease or liver damage can affect the anesthetic response. Use of other medications and genetic variations. Genetic variations leading to the differences in the required dose, potential side effect and even the risk of severe adverse drug reactions like malignant hyperthermia. Pre-anesthetic medication. These are the combination of drugs that are given before the surgery to help the patients feel comfortable and reduces the risk of complication. The purpose of using pre-anesthetic medication is to reduce anxiety, to provide analgesia and to prevent the nausea and vomiting. Then the common drugs which are used as a pre-anesthetic medications are benzodiazepines, opioids and anticholinergics. Adverse effects of general anesthetics: respiratory depression, cardiovascular depression, nausea and vomiting, malignant hyperthermia, hepatotoxicity and nephrotoxicity. We have discussed all these adverse effects previously, and we are also going to discuss the important drugs in detail in the next video. If you like this video, please like, share and subscribe to the AY tutorials, and if you are having any query, you can drop it in a chat box. Thank you.